Welcome to part 3 of this 6-part daily series, Wendy Williams Health, Breaking Down the Illnesses. Be sure to subscribe to my channel and hit that notification bell so you'll be among the first to know when I release my next video. I'm Dr. Frita. I'm a medical doctor who is triple board certified. No, I am not Wendy Williams' doctor, and I am not privy to any more of her health information than the general public. But I do know a lot about medicine, so please go ahead and hit that like button because I'm going to share what I know about frontotemporal dementia with you right now. This is part 3, frontotemporal dementia. So a couple of days before Wendy Williams' docuseries was released, Where is Wendy Williams?, her team shared that she had a diagnosis of frontotemporal dementia and primary progressive aphasia. In the actual docuseries, however, we learned that previously her son had been told that she had alcohol-induced dementia. Make sure you watch part 2 of this series where I break down alcohol-induced dementia. So now let's talk about frontotemporal dementia and discuss whether or not Wendy Williams is displaying any signs or symptoms of it. Frontotemporal dementia is a form of dementia that occurs when neurons or nerve cells degenerate or stop working in the frontal lobe and in the temporal lobes. We normally think of dementia in people who are quite old, very mature, advanced in age. But in frontotemporal dementia, patients tend to be diagnosed at earlier ages. In fact, it's common for symptoms to occur between ages 40 and 65. Actor Bruce Willis was actually diagnosed with frontotemporal dementia in his 60s. About 1.2 to 1.8 million people have the diagnosis of frontotemporal dementia worldwide. So let's talk about the frontal lobe and the temporal lobes and how they function in our brains. Your frontal lobe, which is located right here behind your forehead, is responsible for higher level executive functioning, your behavior, personality, some movements, your judgment, impulse control. Your temporal lobes are located on the sides of your brain, like above your ear, and the temporal lobes are responsible for storing and retrieving memories, for understanding language, for processing. So you can imagine if you have frontotemporal dementia and you have a degeneration of neurons in these frontal and temporal lobes, it can affect some of these processes. Here are some of the symptoms of frontotemporal dementia, or FTD. Loss of inhibition. If you're someone who used to be more of a conservative dresser, you might let it all hang out. You want everything low cut, high, whatever, tight. You may also have a loss of impulse control, where you say things that you normally would not have said, but you go ahead and blurt them out. You may have a loss of empathy. Other symptoms may include apathy, where you have just a lack of interest, and this can be mistaken for depression. You can lose regard for personal space, where you may have been a person who normally gave other people their distance, but now you're all up in their faces. You may be doing inappropriate touching. You can also become hypersexual. You can lose your executive functioning, your ability to plan your daily schedule, your ability to fill out an envelope properly or a form properly. You can also have some psychological problems like psychosis, anxiety, depression. And then language can be affected. Now, there are some subtypes of frontotemporal dementia. One of them is primary progressive aphasia, which is what Wendy Williams' team says that she also has. And you'll notice during the documentary, even though we know that Wendy Williams is a wordsmith and she has made her living off of her mastery of the English language, there were times where she was hesitant in her speech, or instead of using a nice fluent sentence, she might just use 2 or 3 words to express herself, maybe very simple words. Some patients with frontotemporal dementia can also have physical symptoms where they get poor balance, muscle weakness, muscle spasms, rigidity. As far as the causes of FTD, there really is no definitive cause. There have been some studies to suggest that there can be a genetic factor, like if you have a family history of FTD or other dementias, you could be at a higher risk. And there could be a genetic component, either inherited or a spontaneous mutation. But honestly, we really have not pinpointed a cause. As far as risk factors, interestingly, in addition to having a family history of frontotemporal dementia, having a previous head trauma has been cited as a potential risk factor, and having thyroid disease. According to one study, patients with thyroid disease are 2.5 times more likely to develop frontotemporal dementia. And we know that Wendy Williams has thyroid disease. She has Graves' disease. And you can see signs of her thyroid disease in the docuseries. One being the exophthalmos, which is the bulging eyes. So that's an interesting connection. As far as treatment, there's no cure. There's no cure. There are various treatments and managements that can help some of the symptoms to get better. You know, you can manage with a neuropsychologist, with counseling, you can use a physical therapist, things of that nature, but there's no definitive cure for frontotemporal dementia. Now, I want to compare and contrast alcohol-induced dementia to frontotemporal dementia because, of course, again, I'm not Wendy Williams' doctor. I don't know her definitive diagnosis, but we have been told two different things as far as what her diagnosis is. Be sure to watch my YouTube video on Dementia Explained after you finish watching this video. There's a lot of overlap. In both frontotemporal dementia and alcohol-induced dementia, the frontal lobes are affected, and so that loss of inhibition and some of those other symptoms in the frontal lobe, you can see them in both. Also, the irritability, the anxiety, those things you can see in both. The young age at diagnosis, in both. Here is one major difference. The cause of frontotemporal dementia is not known. The cause of alcohol-induced dementia, of course, is alcohol use. And depending upon the time when the alcohol-induced dementia is diagnosed, if you stop the alcohol, there's a potential of reversal of some of the symptoms. With frontotemporal dementia, it's not the same thing. It's progressive. Also, in some forms of alcohol-induced dementia, specifically that Wernicke-Korsakoff syndrome, if you replete that vitamin B1, that thiamine, that can also help with some of the symptoms. The same is not true for frontotemporal dementia. If you suspect that a loved one has frontotemporal dementia, please be sure to consult your physician immediately. Remember, be sure to subscribe to my channel because tomorrow I'll be talking about part 4, aphasia. I'm Dr. Frita. Be sure to like and to share this video, and I'll see you tomorrow.